So, in the first part, we collect the basic patient's information. We use the input function to get the patient's ID, name, room type, and if they needed an operation. We also get their age and days of stay, and we use int function to to convert those inputs into numbers or integers, so we can use them in calculations. Next is we collect the patient's vitals. We get the temperature, which we convert to a float, and the systolic and diastolic blood pressure, or SBP and DBP, and heart rate, which are all integers. Uh, Next, we collect the room rates using conditional logic. This is an if else chain that checks the room type variable. If the room type is ward, it calculates the room bill by multiplying the days of stay by 500. If it's semi-private, it uses 1,000. For private uses, it uses 1,000 for the semi-private. For the private, it uses 2,000, and for the ICU, it uses 5,000. If the user typed in an invalid room type, the else block runs and setting the room bill to 0. Next is we calculate the additional charges. So first, the lab bill is calculated by multiplying the number of the lab test by a fixed rate of 1,200. Second, a simple if-else statement checks the oper variable. If it's yes, the operation fee is set to 15,000. Otherwise, the fee is 0. Then we move to processing and calculations. So first, we calculate the sub or subtotal by adding up the room bill, lab bill, med fee, and the operation fee. Next, we have another if else chain to determine discounts. This chain is checked in order. First, it checks if age is greater or equal to 60. If it's true, the patient gets a 20% senior citizen discount. If they are not a senior, it then checks if sub is greater than or equal 100,000 to see if they get a 15% discount for a large bill. If not, it checks the if sub is greater or equal to 50,000 for a 10% discount. If none of these are true, the else blocks run and the discount is 0. Then finally, it calculates this amount or the discount in pesos and the final total by subtracting the discount from the subtotal. After that, we do the vitals evaluation. This section doesn't do any calculations. It just prints the patient's health status. It's a series of if-else blocks that check the vital signs we collected. It checks if temp is greater than or equal to 38 to print fever. It checks the SBP and DBP variables to see if the patient has high or low blood pressure. And if it checks the heart rate to see if it's too fast or too slow, which if too fast is around tachycardia, or if it's slow is bradycardia.